It is so powerful to have a complete picture of a person's health. It allows you to deliver care that's more compassionate, more complete, more holistic, that it's not just what happens in the doctor's office or what happens in the hospital, but it's what you need at home. It's your housing, it's your transportation, it's your nutrition. Our Medi-Cal programs recognize that, and in order to support that type of ecosystem, we have to share information broadly across communities.
Believe it or not, even to this day, there's patients who they show up at their doctor's office and they say, I was in the hospital for the month. And the doctor didn't know that they were in the hospital. I'm a family physician in East Los Angeles, California. The next frontier for us is the ability to collaborate with other organizations, even if they're our competitors.
Our mission is to ensure that every healthcare organization across the state of California has the information they need to enhance health, improve quality, and lower cost. Today, we deliver health information for nearly 90% of Californians through our data network. It's keeping people out of the hospital. It's helping communities get the care they need to stay healthy.
¿Me pudiera comunicar, por favor, con el señor Arturo?
So whether it's Arabic speakers or Spanish speakers or Cantonese, Mandarin, Tagalog, we want to make sure that we're doing what we can do to make sure people stay healthy.
I use Manifest MedEx to look at patterns of patients that have been discharged from the hospital. Patient had 7 falls within this year.
I see you were recently discharged from the hospital. How are you doing since your discharge?
And within that year, that's a lot of falls. They're being admitted for the same reason. So that's when I step in and notify the provider. Within 3 to 5 days, that patient gets that walker and they're no longer being admitted for the same reason of that fall.
Care teams across the state are reducing health disparities and improving health equity using notifications from Manifest MedEx to provide culturally competent care. In San Bernardino, public health leaders are using data from Manifest MedEx to prevent the spread of congenital syphilis. In San Joaquin, they increased COVID vaccination rates by over 40%, using data provided by Manifest MedEx to target and tailor their outreach to some of the most vulnerable populations in the county.
You put your ATM card into a bank, it knows every single bank account linked to that, it knows the balance of that account, it knows what activity you've done lately. And in the healthcare world, you've got to think about the whole person. When I don't know everything that's going on with that patient, I can't take care of them as well as I could if I had the data.
California is the most populous state in the country. It's incredibly diverse in terms of geography, in terms of population, in terms of language, in terms of culture. We're so proud to serve it. We are a qualified health information organization, which is a critical piece of the state's infrastructure, advancing health equity and our ambitious transformation efforts across the state. This is how we build a vibrant and healthy California for all.